Horse owners can now tap into new MRI technology that had previously only been available for humans. We followed RFD TV's equine expert Lizzie Iwerson to Tennessee Equine, where she and her horse Oliver got some good news.
2 months ago, I noticed that my good horse Oliver wasn't traveling at 100%. He seemed to be limping on his right hind leg. After a checkup and lameness exam at Tennessee Equine Hospital, Dr. McInturf suggested that we bring Oliver in and try out their new MRI machine.
This is our MRI room here at Tennessee Equine Hospital. This is our brand new magnet that we got from Italy. University Medical here in the United States helped us put this magnet in. And it's an Esaote 0.31 Tesla magnet.
On the human side, it's an orthopedic scanner. So why not do it with horses? So now we've incorporated it with Tennessee Equine, and we're able to scan an MRI on your horses.
Hey, Dr. McKnight, we've got a very special athlete in today, a horse named Oliver, owned by Lizzie Iwerson's here. He's got a specific injury to his right hind leg. We isolated the injury to the high suspensory area just distal to the hock.
That region will be placed into the scanner and we'll evaluate whether the ligament is damaged or the bone or both or some other supporting soft tissue in the area, fooling us to think it is the suspensory ligament itself, or sometimes the joints are also involved. So knowing exactly what the problem is will give you the best chance of treating it.
Well, I tell you, let's go take a look at Oliver and see what's going on with him.
Let's do it.
All righty. We pulled off his shoes because you can't put any metal into the MRI. So we pulled his back shoes off, and we put a little catheter in here in his neck so we can give him a little sedative. Okay. We're going to give him a mild sedative. He's going to lay down. We're going to place him on this little table. We're going to roll him into the MRI, and we're going to place his back leg into the MRI machine. The neat thing about it, it has beautiful resolution, really high quality resolution and contrast to be able to see cartilage and soft tissue injury in the horse.
When the horses are in pain, now they're able to find out pretty much immediately what's going on.
Lizzie, the MRI went wonderful, and Oliver's recovering now in our padded recovery stall. He's doing wonderful. Dr. McKnight's going to review the images and give us a report.
Total scan time here was about 35 minutes. To get all of the pulse sequences you need for a typical high suspensory type injury.
And what did you find?
Interestingly, not a high suspensory injury. And this wouldn't be the first time we suspect a particular lesion, only to find out that it's something completely different. It's good news for you, frankly. Suspensory injuries can be very difficult to treat and get back into performance.
After a few more weeks of stall rest, Oliver was ready to be turned out in the pasture to continue healing. It was a great feeling knowing we had a definite diagnosis and were able to utilize the therapies that they have at Tennessee Equine Hospital. Dr. McInturf has been doing shockwave therapy on Oliver, and he continues to monitor his progress. We'll be back to work in no time.
That was Lizzie Iwerson reporting, and we're glad that Oliver is finally doing well.